Hi, Dr. Tom Hopkins here. Just saw a patient who has no major history of any medical problems. He's 21 years old. But on exam, I heard a cardiac murmur on his heart. He's not having any symptoms, but he informs me he's had a murmur when he was little. So going way back when, and he saw a cardiologist. Now he's 21 years old, having no symptoms, but it's important that we evaluate what's going on. Murmurs in young people, no symptoms, probably benign, meaning nothing wrong, could be normal. But if he's having shortness of breath, or a person is having palpitations, or any impairment, even difficulty breathing, it needs to be worked up further. So we're going to order a cardiac echo and make sure everything is okay. This is Dr. Tom with After the Visit.